Hello again, it's Dr. Jarrod Bagley. Again, the topic and the focus this month is on upper extremity injuries. Now, last week we talked about the shoulder injuries and some of the more common injuries and reasons for that. This week I wanted to focus as we move down the arm into the elbow. There are two common injuries that we typically see that I wanted to touch on today, and one of which is called golfer's elbow, which will affect the medial epicondyle and the attachments, the muscles and tendons that attach into the medial condyle, and then also the lateral condyle. When we have injuries to the internal portion of the shoulder, that's typically referred to as golfer's elbow. The external or lateral portion of the elbow is referred to as tennis elbow, primarily because of the actions that you do in both of those sports. With golf, it's because you're hitting the big ball or the earth before you hit the ball in most cases, so it causes a strain or a sprain in those muscles and ligaments. Same thing for the the lateral portion of the elbow when it comes to tennis elbow due to a backhand. So typically these are associated with overuse related injuries, meaning chronic positions. Now, typically you don't necessarily have to be a golfer or a tennis player in order to get these injuries. These will consist of various different jobs as well, or occupations that have the same type of movements. So anything when you're in a position like this where you're flexing your hands or your arms and your wrist, that causes tension and irritation to the medial epicondyle or golfer's elbow. So even sitting at a desk, typing, painting, can be both lateral epicondylitis or medial epicondylitis. But the sheer fact that this occurs just means that you've got repetitive overuse in that injury or in that motion, and it creates injury, and it ultimately leads to inflammation. And if you keep doing the activities that are causing this inflammation, it's just going to continue to get worse. One of the other components that we use to treat this in our office is making sure that there's proper nerve flow, as we've talked about in the shoulder, as well as the traps. And when we first started this deep dive into upper extremity injuries, so this could be a lack of nerve flow that's allowing this to persist, and so the body isn't healing those tissues properly. So we start with the nerve flow, but then we also talk about lifestyle modifications and changes within your habits and ergonomics in order to take the pressure off of this. In some cases, we may need bracing, but icing and some PT therapies are really good at rehabbing these injuries, but you have to rest it as well. So I just wanted to kind of touch on these injuries. If these are things that you're concerned with or you're finding difficulty in recovering from, please don't hesitate to give us a call. I'd love to sit down and talk to you, see if there's anything that we can map out for you to help you get back to your health and your activities. Remember, my name is Dr. Jarrod Bagley. I do love you, and thank you so much for helping me be the doctor that makes people stronger.